This is the Women in Activism Summit that is focused on the issue of HIV/AIDS. It's Women's History Month. It's also the National Awareness for HIV/AIDS among Women and Girls Day. And so we're celebrating both of those.
Today's event was really the idea of many women across New York City who have been fighting social justice, and especially in the area of HIV in New York City for years. And our intention in working with women across the city was really to elevate that platform much more, because oftentimes women are marginalized in almost any and everything that we do. So even in conversation around HIV/AIDS and promotion, we hear lots and have lots of information, and we see lots of ads for men who have sex with men, which is extremely important. We know it affects the African American and Black community more so than anybody else. But what has happened is that we've left women out of the conversation oftentimes in the recent years. And so we wanted to, as the health department, instead of us thinking about on our own, what do we need to do to elevate the voice? What do we need to do in either to inform us in the work that we're doing moving forward? How do we pull women together? And so we convened many leaders over the last couple of months to really plan and to think through what is it that we need at this point in time as women leaders to help us and support us. And it was really simple in the sense of we just want a day in which we can celebrate and relax and be who it is that we are as leaders, and to be among other leaders so that we can share our experiences and share in the positive, but just share what has it been like to be an advocate, and how we show up at the workplace, how we show up in our professional and our personal lives, and in the political space. And so today is honoring Women's History Month. It's honoring National Women and Girls HIV Awareness Day. And the Women's Advisory Board that we're now calling it, I'm so excited, is here all, and they brought many of their friends as well as some of their clients to participate in sharing. We have panels, information. We have lots of tabling and lots of information that's being given out. And we have fun events as well that are happening today. We have yoga. We have meditation. And so today is really a celebration of us, but also an opportunity to say that we are beautiful and we have lots of strength in who we are, and it's okay to come together and to share.
I didn't know that so many people were involved with HIV, and I didn't know so many organizations cared about it, and to see how women were involved and stuff really opened my mind. My favorite part was the first panel. Everything that they said was so inspirational. Now I want to go ahead and do something.
We are facing many reductions in services aimed at women's reproductive health, and many threats to women's rights to control their bodies. It's also a really important time to talk about access to health services, because there are many threats to providing adequate health insurance coverage to our population. The Affordable Care Act resulted in huge reductions in the number of people in New York City who were uninsured. It went from 21% among adults to just under 10%. We saw a huge reduction. Those reductions are now threatened. And of course, we still have people in New York City who are uninsured, and we have yet to figure out a way as a society to ensure that they're covered.
I learned that a lot of Black women or Latinas, minorities, most likely to die from HIV or AIDS if they don't have the proper medication. And it's getting very hard, even with me, living 18 years with AIDS, almost died 18 years ago. And I'm afraid that because I already lost the Medicaid, and I think today I'm very happy that the commissioner gave me a card, so I tried to call to see if I can get my medication.
We have wonderful new tools that allow us to tackle HIV prevention and treatment, and they center on antiretroviral drugs. We need to ensure that people are aware of these modalities, and that's the message I want people to take away. Many people think of HIV/AIDS as mainly a man's disease, and it's true. 80% of cases in New York City are among men, but it's also still 20% among women.
PrEP stands for pre-exposure prophylaxis. It is a once-a-day pill that you can take to prevent from being infected from HIV. So HIV negative people take it once a day so that they don't get HIV. And it is relatively new. It was approved by the the Food and Drug Administration in 2012, so it hasn't been around that long. It's actually a pill. The pill that's used as PrEP, which is called Truvada, is also used as HIV treatment, but it's been proven effective as an HIV prevention medicine as well.
We've made great progress on HIV/AIDS. It hasn't been eliminated, but last year we had the lowest number of cases in the city's history since the epidemic began. The epidemic has taken the highest toll in Africa and continues to take its highest toll in Africa, and it occurs at the intersection of the legacy of colonialism, the dual legacies of patriarchy, both by European colonizers and African traditional societies. And the fact is that people have had to change the way they talk about very intimate subjects. And women in Africa, men in Africa have begun to do that and have conversations that may never have happened before because it's so important to protect the next generation, which in any society is highly valued. So women have to talk with their husbands about what they're doing, what protection they're taking, and people need to get tested. The same message that we have here in New York City, that New York knows, meaning everybody should know their HIV status, is true all over the world. We need people to learn their HIV status, and then no matter what that status is, there is something to offer them. I've been heartened that there seems to be bipartisan support for continuing a program begun under President Bush called PEPFAR, which has been one of the most successful U.S. efforts to give support globally to ending AIDS.
When you speak about the subject matter of HIV and AIDS, people often get shaken by the idea of blood and vaginal fluids, and I'm like, we really need to get back to the fact that blood is life, and that we can take our power back, and that how to activate that power is really to take ownership over the agency that we have in our bodies and our capacity to say who we are and how we are, no matter what our status is. And so I really wanted the women and men that were in this space to recognize that they are powerful and they get to say how this goes. And the way that we thrive is to speak our truths, and then also to accept that this is who we are, whether we're HIV positive or we have full-blown AIDS or any other condition, that who we are is powerful, acceptable, and it's a contribution to life and living. And so I wanted to make sure that they left this space understanding that and understanding that. I consider no to be a sentence. No is an affirmation. No is a declaration. And it can save your life if you know how to apply it appropriately. So sisters, wherever possible, we know you know how to say yes. Yes to your lovers, yes to your family, yes to your children, yes to your job. I'm inviting you to practice the muscle of no for the sake of liberation, for the sake of love of self, and also the sake of loving others, because you love on others when you are able to create balance and boundaries with them. So practice the no, and so will I.